I was always taken that by the time I was standing up and walking, I was going to be a doctor. Original thoughts of the National Health Service, I never noticed it because I was working at a very junior level and things like the National Health Service were not filling my brains. So I really, at that stage when I should have been looking at it and seeing how what it's like, rather than just working, it would have been an interesting thing to do. I'm sure that the original running of the hospitals, long before the National Health Service really got going, the hospitals were run by the matron. And then there'd be an officer who would be a young solicitor or something like that, who'd be the sort of house governor of the thing. And the whole hospital was run by the house governor, the matron, and an office boy, and that was it. But now, of course, you have enormous numbers of people running hospitals. It's quite an extraordinary difference. I can remember vividly the days when the matron and the manager were walking round, and that was it. There was nobody else involved. When war broke out, it was really quite a drama because there was an immediate calling of any students who were not actually there doing the job at the time to come in immediately. Emergency calls were out so that everybody was there, and it soon became clear that the concept was to make it all much more compressed so that they could complete its qualifications quicker, because there was a demand, of course, for doctors. And when this all started, they put 2 years of lectures into one, and that meant that everybody had to work like crazy to catch all the information that was flying around. People had to come rushing in on the tram to catch lectures at the right time and so on. So it was a bit of an excitement. And I think once the drama of the start was carried out, the general arrangements were very well organised. In my final year there, many of the junior permanent staff in the hospital had gone off to the forces, and the final year students doing exactly what the people who had left, they were the ones who carried on, so that we had students as a whole running the junior part of the hospitals. It was really very good because it covered not only the teaching hospital but also surrounding hospitals. By the time we graduated, we all knew which of the forces we were going to go to when we were called in. I've been in the forces quite some time, and at a time when the flying bombs were really in the air from Germany and straight into London if they could manage it. There was an arrangement made with the fighter aircraft to chase after these things and fire at them and hopefully explode them before they reached any other place. And I was with a squadron somewhere inland from Eastbourne. One day, there was a real problem with people landing large aeroplanes on this emergency landing strip. As a doctor, I went to see anybody from the group who was in the local hospital. I was greeted by the matron taken to see the patient, which I went. In the course of conversation, she said, "Are you coming from the camping bit where the aeroplanes are landing?" And I said, "Yes." And she said, "How do you manage there in camping?" And I said, "Basic." And she said, "Would you like to have a bath?" Which I thought was quite bold at the time, and I duly did have a bath and thoroughly enjoyed it and probably needed it. And after that I went back to the area where the landing ground was. Just as an emergency landing of a bomber took place on the field, one of the crew was based right in the nose of the aeroplane as a bomb aimer. He had been hit by 2 bullets and couldn't move. And I was told to go get down the aeroplane right up to the nose and get this man out with his bleeding belly, which I did. It was hard work, I can tell you, and the result of my just recent bath was wasted completely. Well, when we were demobbed, the arrangement was made to have the people being demobbed with a suit, because they were all in uniform, of course. And there was an area somewhere there near Liverpool, I think, for all people being demobbed, fitted out with a suit and then sent home, which I did. I went in a terrible, terrible old suit, actually. It was brand new, but it wasn't particularly pretty. I went to another hospital in Ilkley, which was a sanatorium of its type, a gentle sort of place, during which period, I must admit, to say that I'd met my future wife and I'm married, and I spent nearly 5 years in Ilkley, during which time our family produced 3 children. Well, in those days, the word geriatric, I'd never heard of it, and certainly if they had, they didn't know what it meant. But there was a tiny number of doctors, some in Scotland and some in London, calling themselves doctors looking after the elderly, which was the beginnings of all sorts of things happening in healthcare for older people. I was working in another part of that hospital and was invited to join one of our pioneer geriatricians working from Leeds to help him. And I spent quite a number of months there, and then went to work with Dr. Hugo Droller, one of the real pioneers. And I spent about 2 years learning about old age and what you can do. And at the end of that period, I was appointed as a geriatrician myself. I was appointed as a beginning as a specialist in North Yorkshire, which was, of course, where I had lived and still did. And that was where the beginning of geriatrics, as far as I was concerned, took place, and I was enthusiastic. I quite enjoyed the business of looking at small groups of old people who were just put into bed somewhere. And I made a grand tour when I was first appointed, trying to find all these places that had potential people for treatment, rather than just being bedded down. One of the more entertaining outings of all of that nature was I went to see a small hospital in Stockton, which was had only ladies, of course, in those days, all in their ward, in bed, beautifully bedded down, with everything looking very smart. And I went around that place with the matron, and I said to her, "Don't you think that perhaps some of these people could be got out of bed and get into chairs?" And there was silence. And then the matron said, "We haven't any chairs." That was the beginning of one of my grand hunts in trying to find out the sort of equipment patients needed rather than the medicine. I must say that getting on with developing the requirements for old people in hospital went very smoothly, because, if you like, board of management of hospitals in those days were very keen to see things growing and developing, and whatever I tried to do, they gave me help from day one. So I did that with a gradual swelling of all the things that you could do for old people, including even a geriatric surgical ward, and it was good fun. There never seemed to be any real problems with the management or anything like that, because the management somehow didn't really want to see me. All they wanted was something to be seen for what had happened. So anything that could be grown and shown was very good for business. Except that we were active in getting them moving. The ward looked as if people were a bit untidy because people were sitting in various places. But the need of being in bed all day in the hospital had gone. The days when you kept everybody lying on their back were over. In the days when I was really pioneering as a specialist, it was a case of developing something new almost every time. It was very, very good fun. And you had to deal with the administration, such as it was, because it was carried out by everybody who was working in the hospital anyway. It's a bit of a difference from the days when there used to be lots and lots of managers. The managers didn't exist in the early days. When the health service came into being, nobody knew about them. Finding the staff, medical staff, was the big fight. And I think later, of course, it became the other way around, that the doctors got quite encouraged and happy, and the management dealt with all the sort of worries that there are about a hospital. My work in Teesside was in a hospital that had been constructed for the war. It was a wartime hospital with lots and lots of surgical theatres for treatment of violence. And the surgeon who was the specialist for surgical orthopaedic surgery He was in the sanatoria, which had been abandoned. They tried to turn it into a surgical unit, but the building wasn't very satisfactory. And I was really a bit short of beds because there were so many operating tables and things in the hospital that I occupied. One day, the orthopaedic surgeon and I had a prolonged cup of coffee and discussed what might possibly be a great idea if we could only pull it off. And that was to swap hospitals. Keeping quiet, I must admit, it was done really quietly, and we did a direct swap of the orthopaedic hospitals where I had been and the one that the orthopaedic surgeon had been. And guess what? Years earlier, when I had been a patient, I was back in that hospital, but running the show. If I was asked what influence have I had, I suppose that the influence is just doing it. Not arguing with anybody, just getting on with it. One of the things that I quite enjoyed doing was at the old large establishment called Mount Royal Hospital, which was one of the places where literally admission there was regarded as what you should aim for, instead of being the reverse. So trying to turn those people around and to go out again was quite a difficult thing to do. But it happened, and it happened just because I did it. I just sent people home again, and they seemed to get on quite well, for the time being, anyway. Oh yes.
Say something happy.
Yes. Who's that strange lady? Oh, it's you. Yes.